Good morning, everyone, and welcome. Welcome today to this very special session of Fulsome Friday. And we thought that it would be a good idea for you to have an interaction with people also who are specialists in their field and the beautiful way that they are incorporating radical in their whatever field of work they are working in. And here today, it would be equally interesting for all of us to know that our very special and very dear Dr. Rina Jani, who is an homeopathic practitioner, and for her hand, her voice, her diagnosis is so perfect that I can vouch for it because I have also taken healing from her apart from the medicines. And sitting far away, she's in Bombay, I'm in Delhi, but it worked so wonderfully. And more than that, I think it was her soothing voice that made all the difference. And just imagine, with that beautiful soothing voice, she uses that to have radical statements as affirmations for her clients, actually, her patients, not clients. And that is something that has worked wonderfully and marvelously for her clients too. Again, clients, sorry, patients. And I thought that why not give this benefit to all our, Fulsome Friday gang so that they also can understand how she uses it, what is it that she thinks, and how does it come to her that which is the correct chakra or which is the correct statement that she has to give to them, which works for them beautifully. So it's not going to be a lecture from her, it's going to be a dialogue. We'll talk to her. Let me have a little conversation with her, and after that, it's open to all of you to ask your questions and ask her anything you related to the field of homeopathy for her. Whether it's an ailment, whether it is some clarity, whether it is some knowledge, it's all up to you. And remember, she will be topping it up with Redikall Affirmations. So again, we are so grateful to Redikall for coming into our lives, making life so much easier for us because we know it's an auto-healing tool. But beyond the auto-healing tool, it is something that has made everything and everyone around us feel the benefit of it because of the shifts that keep happening, right? Physical, mental, emotional shifts which lead to a healthier, happy, easier, and effortless life. So let us now invite Rina. Hi, Rina. Can you switch on your camera? Yeah,
Hi,
that's
Aarti.
hi.
Good morning, Aarti. Good morning, everyone.
Good morning, Rina. And let me pin you. Yes, that is wonderful. I think that's
Thank.
myself also.
I
Ah,
would like to thank you, Aarti, for such a wonderful opportunity. Thank you, Redikall. Thank you, Atman, for channeling such a wonderful things. Thank you, all the masters.
yes.
And thank you, each one of you
Yes, we have a
present over
lovely
here.
crowd already. Many people have joined already. So, before we can open the house for them to participate, Rina, I'd like to ask you, I'll call you Rina. I'm not going to call you Dr. Rina, okay?
No, no, please call me Reena only. And I want everyone to call me Reena only.
All right. So, Rina, tell me one thing that I know you've been practicing homeopathy for a number of years now. How many years have you been doing it? Homeopathy?
38,
Huh?
38, 38.
Oh my goodness, 38 years of homeopathy practice. Okay. And then you mastered Redikall. Okay. And once you had learned Redikall, what prompted you or what made you think that you can use it as an additional tool for homeopathy patients? What came to your mind? How did it come to your mind?
So the thing is that there is a limitation in every practice. And in homeopathy, like I was getting the results, but people used to come back with the same complaint, again and again.
Mm,
A few people, not all the people, few people. So
mm,
I was trying to find out that how we can help them.
Please mute everyone. I would request you to mute. Yeah, sorry.
Yeah, so the empath in me wanted to find out that how can I help each and every one of them.
Mhm.
And Redikall has helped me so much that, I cannot tell you how wonderful it is. Like, now patient comes, I mean, there are so many people, they come with the relatives just for the affirmation. They don't have any problem, like
Right,
physical problem, but any relationship issues or a financial issue or any other complaints.
right.
Even for the pets, they come.
Okay, okay. So
Yeah.
you give, of course, apart from the medication, you give them radical affirmation statements, which seem to be just what is needed, for them at that point. Correct?
I gener- generally I combine radical statement with the medicine, but there are people who doesn't have any physical ailments, so for them only radical statements are suffice.
Okay, okay. So can you give me, tell us, give us an example or a case, where the effect and the work of radical was absolutely even a joy for you to know that, wow, it works so beautifully.
Yeah, I mean there are so many, but I'll tell you the few, like which has, I mean I have felt so good after that.
Right,
I'll let you know about that.
right.
So there was one lady who had a injury on her head around this area. Okay.
Okay.
And it's been, I think, since 7, 8 years, she had an injury. She had undergone all the CT scan, MRIs, everything. But the pain and the burning never used to go away.
Right.
Uh, Allopathic medicine, homeopathic medicines, they used to give relief to her. But it used to stay. So after Redikall, when she came to me, looking at the chakra over here, I just randomly asked her that, I mean, is there any issue with the commitment? Or do you feel let down by the people, or do you feel that your voice has not been recognized, or whatever commitment they give, they are not ready to keep that commitment?
Mhm.
And immediately she said, yes, ye to problem hai, this is the problem.
Uh-huh.
And when I gave her that affirmation, within 4 or 5 days the problem has totally gone. It's been almost 3 years.
Wow.
She comes to me for a different reasons,
Right,
but not for the same reason.
right, right. This is amazing. This is wonderful.
Yeah, amazing, amazing. Meaning, I mean, all thanks to Radical and Atman for channeling, because such small things like when looking at the patient and their local area where they have a complaint, that gives you a clue that where the emotions have been trapped and what is the metaphysical reason behind that. And once you tap into that, it works so well.
So actually, Reena, come to think of it, you have a double advantage as a
Oh
healer
yes,
and the doctor because you having, being a homeopathic practitioner, you know each and every chakra, the location of each and every chakra. And for people like us,
most of them.
yeah, most of them, of course, I'm sure it must be 90%, if not less, if not more. But for people like us, we have to think, okay, if I'm having a pain here or something here, first let me look it up, which chakra it is, and then because it doesn't come top of the mind to us, that okay, this is commitment chakra, this is laziness chakra, this could be anything else, So this is something that comes as a big advantage to you, isn't it? So,
Absolutely, absolutely. Like, and I mean, whenever they come, first thing, whatever they are saying, now I pay attention to that particular area, and then immediately the things come. So I ask the relevant questions.
right, right. Yeah, so that makes it even more believable, right?
Yes, yes, yes.
Tell
I
me
would
about
like to give you one example. There was a patient, around 70-year-old male patient. He was having a dryness over here,
okay.
okay, on the right side of the lip,
Mm,
dryness. And that's the unfairness chakra. Okay.
mm,
So I kept on digging, 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 any unfairness feeling, any abusive feeling, anything, nothing, nothing, nothing.
ah,
And I'm saying, ऐसे तो हो नहीं सकता है अगर if this part has been affected, definitely there has to be some feeling of unfairness or some feeling of abuse of something.
mhm,
And then I said, okay, started reading the keywords and I came up to abuse of resources. and he says, "There you are.
Okay. Oh.
I'm unable to take people abusing the resources, using the plastic bags, throwing the plastic bags. He said that I feel that I'm unable to do anything about the environment,
Mm.
and that's it. The
Wow.
statement was given,
Right.
and his dryness has gone, which was there for since so many years.
Wow. This is incredible. This is really fantastic.
Yeah.
And I think, yeah, I mean, we look at medicine or medication as a process of healing something that is affecting us in a particular area of our, body. Yeah, not realizing the complete connect that the energy has with the body, and if the energies are depleted for all the reasons that we are storing inside us also, our thoughts, our feelings, our emotions, our behavior, our patterns, not realizing how much of that affects, the impact it has on us physically. And just with simple radical statements, you are able to help out so many clients and so many people. I think this is absolutely amazing. People, why don't you give her a thumbs up or a clap for this? This is absolutely wonderful. And I'm sure there are a lot of other people who practice it with Radical too. But yes, this is wonderful. But I'd like to ask another very pertinent question. Did people accept it easily that, you're giving them statements to do? Do they find it
Uh,
believable, or do they think that, okay, she's saying it, so I should do it? I mean, because everybody is
uh,
familiar with Radical, right?
Right, true. So there is a 50-50. There are some people who are like, staunch followers of me. They will say, okay, aap jo bolte ho, we'll do it. You know.
Okay. Okay.
But there are intelligent people, logical people, analytical people, especially like my husband,
Hmm.
who will not agree immediately, but seeing the result, they will say, okay, yeah, it works. It definitely works. Like, my husband always will say, no, no, it's medicine what has worked, not the statement. So I said, okay, once don't take the medicine and just be with the statement and let's see what happens.
Right.
And then he says, yes, it 100% it works.
So I would like to here make a shout out to all the logical minded people that keep your logic. Yes, it is needed. Keep your analysis. Keep everything where you need to know everything before doing it. But when we are talking of healing, just package your logical mind and keep it in a separate pouch and open up to the vast world that opens up when you are dealing with affirmations, healing, therapies, because nothing can work better unless you complement it with, the absolute supreme power of the metaphysical world, and Radical is one such tool that is there. So, all you logical people who are listening to this, every time, even when you're doing your own healing and questioning that, okay, if I do this, what will happen? If I do this, what is the result? Don't do it. So, I'm sure a lot of logical people here would get the message that I'm trying to pass on. Right. And yeah, thank you for
I
this.
would like, Aarti, I would like to tell you one thing. So, medicine definitely works, but combined with radical statement, it accelerates the process of healing.
Okay, okay, awesome. Any other example you'd like to share? Because then I'll open the house and the floor to people for to ask their
Okay,
questions.
okay. So, like, I'll give you a few examples. So, there was a male patient who was having a tennis elbow.
Okay.
And along with that tennis elbow, he was even having the pain at right ovarian chakra, okay,
Mm-hmm.
right synchronicity chakra. He
Mm-hmm.
was having both the things. And when I dig down, he their building had gone into redevelopment since last 15 years, and nothing was happening.
Okay.
Okay,
Mm-hmm.
so I combined both the chakras, understanding his problem that he wants to receive his flat
Mm-hmm.
or the rent which is not been given to him, and because of that somewhere he feels that his connection with the higher consciousness or the divine, he has lost it. because tennis elbow is the place where the vulnerability chakra is there. So
Right.
where you have to believe that your higher consciousness can safeguard you.
Right.
So I combined both the chakras and I gave him a statement. And to my surprise, the building which was held for 10 years, nothing was happening. They changed the builder and it has started the process.
Wow. This is
Just imagine one person doing, and the beneficiary of that whole building is the beneficiary of that.
yeah, yeah. Because
I mean,
this is absolutely marvelous. Because here you're
yeah,
talking beyond just the physical ailment. You went at that level, at that level of consciousness where uh, his own consciousness was connected so beautifully to the building that he lived in, and his concern, his care, and his love for wanting it to become, move instead of stagnating where it was affecting him. This is amazing.
definitely.
This is really fabulous. Right.
But definitely, homeopathy has helped me to understand his body mind, because we go deep down asking the questions ki why it has happened. And so that I could connect with Radical. Otherwise, the connection becomes very difficult. That what the building has to do with the tennis elbow and the right synchronicity chakra, like receiving at on time in the right manner with the right people.
Right. But Rina, here you've given me another beautiful example to share with everyone. And that is, you just said in homeopathy, you go deep down at every level, asking the kind of questions which will lead you to what the base or the reason or the root is of the problem. Correct? And that
Right.
to do with your logical mind. But
No, but
results
yeah,
that you're giving are based on absolutely openness and the faith and the trust that you have in yourself and in Radical to give out all those solutions. I'm not talking of the medical part of it. I'm not talking of the
yes,
homeopathic medicines part of it, because that naturally needs a complete analysis that what is the right medicine that will work for the kind of problem a person has come with. Correct. But then
true, absolutely.
again, why I'm saying this, Rina, I'm repeating again and again. We have a lot of viewers here who are not able to go beyond wherever they are, stuck, because they're always just asking themselves from their conscious mind, or working or even saying statements only from their conscious space, the logical space. So that restricts them. So, why am I repeating this again and again for people? Is to understand that it works. All you have to do is see it complementing each other and making a beautiful mix of it for it to work for you. So don't allow yourself to get stuck only in the logical space, in the analytical space. Learn to move beyond. Correct me if I'm wrong, Rina.
Absolutely, absolutely.
Right.
Like people come with the elements, but they share their another stories also,
Yeah.
and which can lead to the right affirmation and which will work as a whole.
Yes. Yes.
Whole and complete healing will take at all the level of the consciousness.
Yes. That is true. Great. Uh, uh, is there any other non-medical question or anything that a person wants to ask? Please raise their hands. Then I'll open the floor for everyone. One by one, of course, the hands will have to be raised. Lakshmi, you'd like to ask a question, or is it a healing question you need?
Good morning, ma'am.
Good
So
morning.
this
Good
is
morning.
yeah, this is wonderful listening you that particularly that liberating thing. I loved it. I mean, so many people were liberated. Building, not getting back their houses is like most traumatic. But actually, I raised my hand because I have a medical issue. But maybe I'll wait for it. Whenever you open the
Let me-
house,
yeah, that will be great, Lakshmi. Let's just see if anybody has a non-medical.
I'll wait.
Yeah.
Sure,
Yes,
sure.
Natanya. Natanya,
I'm
yes.
waiting for
Yeah.
I'm waiting for the open session, ma'am. I don't
Okay,
have
you're
any
waiting for the
non-medical
open
questions.
session too. All right,
Yes,
so I think I'll
ma'am.
open the room for everyone to start asking the questions. Please raise your hands and it'll be one by one. I think we'll start with Lakshmi because she was the first one. So yes, Lakshmi.
Thank you, ma'am. So I have been having a tremendous hair fall for the last 6, 8 months. I retired from my very active, I was a banker. So on 31st August, I retired. After that, I'm actually taking care of my hair also. Earlier, maybe I would say I didn't have time, but now I'm taking care of everything. But my hair has fallen like everywhere. Even my maid is asking. So everybody is asking me about that. क्या हो गया ऐसे क्या हो गया like now, and as such I never give much importance to looks and things. ठीक है गिरे ना आ जाएगा वापस. I know that every day 100 or so hair falls and then it grows back, so I never really worried about it. But now last 3 4 days the worry part has come, that actually you can see the bald patches, I mean each hair thinning down so much that uh, I can't even, I only can feel the hair so thin. I'm so scared to switch the fan on and cook because I'm scared that some hair should not fall
All right.
to
So
that level, ma'am.
yeah. So I would also request all of you to make your questions very precise, because
That's
there will be a lot of people asking questions. So it's about your hair.
Sorry, ma'am.
No, don't be sorry. So Rina will now answer it, and then I will take it up further.
Yeah, so Lakshmi ji, if you have any physical conditions, like diabetes or high blood pressure or thyroid issues, first you need to take care of that, because in all these complaints, there are reasons for hair fall. Plus, at this age, the hormones also goes down, which also causes the hair fall. But metaphysical reason, if you go to see, hair has our DNA. So when there is a tremendous hair fall, it tells you to reach out to as many people as you can. So just think in even think in that line,
1 minute.
that how can you reach out to many people as you have enough time now. Just find out that which is the possible way where you can give your advice or your knowledge. Spread the knowledge whatever you have. And I have got the result with this. When I'm telling the people to reach out, I find my need to reach out to as many people as possible.
So Lakshmi, keep that as your statement. IR5, my need
to reach out
to as many people.
IR5, my need to reach out. Yes, ma'am.
Yeah.
Thank you so much.
And you will automatically get like next sentence. Just keep following that, because that's the beauty of the Redikall. Once you are connected with your subconscious will guide you, because subconscious has all the answers.
Yes, ma'am. IR5, my need to reach out to people.
Yeah.
Thank you.
In a constructive way.
IR5, my need to reach out to people in a constructive way.
Yeah.
Thank you.
Thank you so much. Thank you.
Awesome. I would also like to tell all of you that if there is a need for a medical intervention where Rina has to maybe prescribe or tell you what medicine, the homeopathic medicine to take, please take a private consultation from her, and then she will have it delivered to you, because this platform we will only talk of radical statements that can help. But if she says you need to take medical prescription pills, etc., also please reach out to her directly for that. So I just wanted to clarify this so that we have no confusion on that. Yeah. Yes. Thank you so much, Lakshmi. Yes, Natanya.
Good morning, Aarti ma'am and Rina ma'am. So I'll share. I have hair fall problem, but mainly on the left hand side. And for past 7 years, I have acne on both of my cheeks. And third one is, I don't know whether I got it from my family DNA, genetic. I have headache issue. So my grandpa had it, my father had it, and now I'm also having it. So these three things.
Okay. So basically, Natanya, your hair fall issue, as I said, that need to reach out, but you are saying that it's mainly on the left hand side at
Left.
near the temple
Yes.
region. Plus
Yeah.
headache, where exactly you are getting headache?
All over.
All over. So mainly the reason for the headache is too much of confusion or a conflict or a doubt on self, or you are not able to take the decision. Okay. And the acne, the reason what you are showing, it's a sensitivity chakra and the amiability chakra. So you are not able to handle the irritation from your environment, as well as you are irritated. 1 second.
Sure.
So you are even irritated with your own self also, because you are not able to decide. You don't have a clarity that what you should do, what should you go ahead with it. So combining all these three things, first you need to work on the clarity, need for the clarity and a confusion, and positively able to handle the irritation of others. Like, I calmly handle the irritation of others, or your sensitivity to others, and need for the clarity. You have to work on both the things.
Okay. Okay. I believe on Wednesday also I got similar chakra where I don't have to get irritated based on my external environment. If they are
Absolutely.
irritated, I don't have to grasp that. Okay. So
Absolutely.
what statement can I say for this
So
clarity?
what is the
Clarity.
most bothering thing you are having right now? Whether it's a headache, or whether it's a hair fall, or whether it's a acne. What is the most bothering thing? Because we deal accordingly.
Ma'am, acne and headache, ma'am. Hair fall, though I can take care, but acne and headache are two things that actually bothers me.
Okay. So headache is also because of too much of acid level in the body, too much of bile in the body. And again, bile is related to your solar chakra. Okay. So too much of anger again. Too much of anger or irritation. So you need to work. It can be anger, or it can be irritation, it can be anxiety. So you need to work mainly on your irritation and sensitivity to others' irritations towards you. Be
Okay.
calm. Be calm. I calmly respond to each and everyone.
Okay. I calmly respond to each other. Okay.
Or else you can say that uh, calmly responding to everyone in my surroundings helps me to get clarity.
Wow,
Surroundings.
what a beautiful statement. Calmly
Yes.
responding to everyone around me brings
I
Helps me
calmly
to bless.
respond. I'll
Calmly
repeat it once
responding
more.
to calmly responding to each and everyone helps me
In
to
my
get
surroundings.
clarity. Helps me
In
to
my
get clarity.
surrounding,
helps me
helps me
Helps
to
me
get
to get
clarity.
clarity. Yeah.
Got it.
You
Got it.
can put in your words, whatever resonates with you.
Okay. Okay, ma'am.
and I would just
Um,
recommend that you add with soul's love in the beginning. Okay?
Ma'am, I already added, ma'am.
Wonderful, wonderful. This is a beautiful statement, Rina. Thank you so much. I think a lot of people would have written it down. But by the way, this recording is going to be made available, so it's going to be there. You all can listen to it every time. Okay? So yeah. So Natanya, you're done.
Whatever master Arti, whatever masters are guiding me, I am just saying the statement because uh,
I
it's
know.
like, I'm just whatever is coming, I'm just guiding them.
I know that,
Okay.
and I know you are beautifully guided by the masters, Rina. Yeah.
Ma'am, about sensitivity, can I say if I'm in need for sensitivity?
Yes, you can. That's what I said.
Okay.
Once you start reciting the statement, your subconscious will guide you automatically what to say
Okay.
next.
Okay.
And it will
Thank you so much.
beautifully it will unfold, and you won't even won't have imagined that how beautifully you can guide your own self.
Awesome.
I totally
That's
believe
the
in
beauty
that.
of
Thank you
Redikall.
so much.
All right.
Yes, it is.
Thank you, Natanya. And yes, Sri Vidya.
Yeah, thank you, ma'am. Thank you, Radical Consciousness, for giving this beautiful opportunity, ma'am. Ma'am, my concern is dry, itchy skin. Can you give me affirmations for that?
What did you say, Srividya?
Dry
I have a
skin. She
No, I
has
didn't get it.
she has dry, itchy skin. That's what her problem.
Okay, dry, itchy skin. Mainly itching is the belief system. You need to work, you need to find out that what belief system and what are the adverse association you have with that belief system. If you work on that, the slowly, the dryness and the itching will go away. And if it is in any particular area, then let me know. So accordingly, I can guide you. Or if it is the overall skin,
overall.
yeah. So basically, skin is related to the care, nurturance, self-love. You have to do that, and you have to work on your belief system. Any adverse association.
Okay.
Awesome. So, Srividya, you'll formulate your own statements, correct? You can do that. Lovely. All right. Thank you, Srividya. Yes, Seema?
First of all, thank you so much to Aarti as well as Rina. Of course, Redikall Atmanto is every time. And so my question to Rina is that I have very slow peristaltic movements. And, as Natanya also shared, now this is a very, it's a family pattern. So I know my father, my chacha, my bua, even my cousins, a lot of us are facing this. So with the result, the food gets digested very fast and there is constipation. So can you please guide me?
Yeah. So low peristaltic movement, basically it causes the constipation.
Yeah.
And the constipation, as you know, the reason you are holding back to many emotions. You need to release it.
Mm-hmm.
You have to let go and let flow. And you have to forgive yourself for holding back all the emotions. And as you are saying that it's coming from even from your parents or from the generation, then possibly some ancestral issue also of holding back. You have to just release it.
Mm-hmm.
And you have to forgive yourself for carrying all these things for so many years and giving so much of trouble to your body. So just you can just affirm that I let go and I let flow.
Okay.
You
And
could,
I don't need to go into the ancestral pattern.
what you can do is that with soul's love, I
Soul's love.
graciously forgive myself for holding on to patterns or whatever across time and
Yes.
space. So that will take care of generations also.
Yes.
Yes.
Thank you.
Yes.
Yes.
So I let go and let flow also across time and space. Yeah?
Yes.
Okay.
Absolutely.
Okay.
Absolutely.
I graciously forgive myself for holding on to
Whatever. Patterns, emotions, belief systems
Across time and space.
Yeah. Okay?
yes. This is
Aarti, I have a question.
Rina, you'll have to raise your hand. We are going hand by hand.
Okay.
Everybody
Okay.
gets
I couldn't find the hand.
No,
Okay.
no worry. I have you in mind. I'll have you
Okay.
after Neeta. Okay? Don't
Okay.
I'll have you after Neeta. Yes, Sanjoli?
Hello, ma'am. Hello, Rina, ma'am.
Hello.
My question is like one is constipation that is covered. I've also written down these statements. The second thing is gynec problems like multiple miscarriages, PCOD, tubal blockage, and things like that. So, what could be my statements?
Okay. So any hormonal issues? Have you checked all the hormones, like especially the estrogen, progesterone, thyroid hormones? All are okay?
Yeah, all okay.
Okay. Because PCOS is there. That's why I'm asking. Okay. So basically, when you are having a gynec problem related to female reproductive organ or the PCOS, basically 100% you are not accepting your feminism. You somewhere you have an issue that why me? So you have to work accordingly that with soul's love, I accept my femininity. Or with soul's love, I accept the woman in me.
Yeah.
Okay.
I accept and embrace the woman in me. That would be a good idea.
Okay.
Accept, embrace, and honor the woman in me. Accept, embrace, and honor my femininity. Accept, embrace, and honor my feminine energy. So many factors. I think you work on these. And also, I would recommend Sanjoli do get in touch with Rina. I think even from the prescription and medical point of view, you can talk to her. She's a marvelous doctor. Okay, and she'll courier you the medicine, so don't worry about it.
आरती चने के झाड़ पे मत चढ़ा दो इतना.
Chane ke jhaad pe nahi, your humility, your grace, and the way you deal with people, Reena, is something that everybody hopes, that they can be part of it.
I can vouch for her medication. Only one she said, and I'm out of my, I can say 60% of the problems daily, which were I
Awesome.
was having for years.
Awesome.
One
Thank you,
she
Preeti.
only secluded with me.
Right.
Thank you, Preeti. Thank you so much.
And I'll
Thank you
vouch for
so
her
much, Reena.
generosity.
Yeah. So you'll have to
Ma'am,
turn
can
on
you?
cameras to talk. Today we are going to have camera to camera sessions. But yeah, right now I'm going as per the order. So after Neeta, I will have Reena, and then I'll have Parmeet. And Preeti, you can also come in later. Yeah. Yeah. Saifa.
Ma'am, just one thing, one request, ma'am. Can we have her number so that we can get in touch with
It's
her?
in the Seekers group. She is part of our Seekers group. It is there.
Okay.
And otherwise, if I can write it in the group also right now, I'll write it in the chat. No worries.
Sure, sure.
All right.
Thank you so much, ma'am.
Welcome. Yes, Saifa.
Hi, ma'am. Good morning.
Good morning. Can you switch on your
Good
camera?
morning.
Sure, ma'am. I will. Hello,
Yeah.
ma'am. Hello, Dr. Rina, ma'am.
Hello.
Okay, so my question is, I'll be having repeatedly UTI and PID, and like once in a week, I'm getting this kind of symptoms that I'm having. Like my body will be feverish, and also I have diagnosed with second or third grade of uterine prolapse. I guess 3 to 4 years back, and I am nully gravid. I haven't conceived yet.
Okay. So for uterine prolapse, I haven't dealt with that, but you can do some yogic exercise or pranayam for that because the muscles have become loose over there. But for UTI, definitely we can work on. It's basically some anger towards yourself or towards other, or some things which are making you angry, which are making you pissed off, which is giving you repeated UTI. So you have to work on your anger and irritation towards self and others.
Statement.
Statement with soul's love, I calmly respond to my irritation towards myself and others.
Thank you, ma'am.
Thank
So
you.
for all of you who are noting down the statements, remember, for it to work, you must do it at least 21 times, twice a day. Whether you want to write it down or you want to say it, please do it twice a day, once in the morning, once in the evening, at least for a start for 21 days. Correct me if I'm wrong, Reena, or would you like to suggest something
Yes,
else to
yes.
them?
No. Absolutely right. Absolutely right. And Saifa, just find out that there is no underlying sugar issue or anything
No,
because
not yet.
repeated UTI, it's not there. Okay, no problem.
The
And
doctor
any
said me due to prolapse, I am having prolapse, so I cannot hold my urine for longer. So
yeah,
it will be urine retention, so I'll be developing UTI repeatedly.
okay. So you can work on that. No problem.
Thank you, ma'am.
Thank you, Saifa. Yes, Varsha.
Hi, ma'am. Good morning. I'm last few months, I would say, I have started facing back issues, especially I'll just get up and show. This is the hip area where it started, but right now I'm having pain here, which is like the lower middle back, and that lower middle back it's kind of also feeling restriction of movement. Though I'm doing statements and doing stuff, it's just not help. It's quite severe. Like yesterday, it was quite severe. I felt I can't move. But with taking painkillers, medication, inflammation, and stuff, I think I'm a little better, but it's coming on and off.
So what statement are you doing, Varsha?
So me and Amy actually did almost a full session where we're kind of opening, seeing
No
what
problem. So it's a in between, like it's not on the sides, right? Lower middle.
It's the lower middle, I would say right now, but also goes towards the hip area.
Towards the hip area. Okay.
Yeah.
Both the sides. Both the sides of the hip area.
The lower middle is exactly in the center.
No, and in the hip area, which side, right or
Both
left?
the side, both the sides.
Both the side. So, are you holding back something which you need to move forward? There is something in the space which needs you to move forward, but you are holding back. Your reluctance to move forward, or resistance to move forward, or any fear.
I would say there are multiple things at the moment that I'm doing, but I mean in terms of learning courses, but everything gets halt for some or the other reason. I mean, it's not that I would like to do it, but maybe the conditions come like that where I am kind of putting a pause for it. Not that I'm dropping it off completely from my head, but it's like, yeah, it does.
Yeah, so that's what is, you yourself said that there are many things and you are not able to move forward with everything. So you need to find out that what is the resistance, why you are not able to move forward, why you are dropping it out things.
Some resistance to move would be hip, but the lower back, middle back area.
Lower middle back area is basically stooping towards the thing. So possibly what you are not able to do, you feel that either it can be the money issue also, stooping because of that, or stooping because not able to fulfill all your desires or all your commitments.
I would
so because
say,
of that
yeah, I feel stooping towards because not able to complete my desires, I would say.
yes. So you have to just affirm to yourself that with soul's love, I easily and effortlessly move forward.
Okay. With soul's love,
But before that, I think you need to do a lot of resistance wala statement.
Okay, ma'am. And ma'am, one more thing. Now, this is only showing in the middle and the lower. But because I had this issue, I did an MRI where it is showing from the neck region, cervical, se leke niche tak, multiple levels. At 8 levels, there is slip disc.
Okay. So
Okay.
when it is the whole spine or multiple level of spine, basically it's an issue with the alignment. Spine is the metaphysical reason is the alignment. Okay. So the reason you are doing many is that you are not able to. One second. I'm sorry because too many phone calls are coming. I'm extremely sorry.
No.
Yeah, so reason because you have taken up so many courses and you feel that you are stuck somewhere, not able to go forward, and the spine. So somewhere you need to align to the course which is absolutely aligned to your life plan. Okay, and I think in that you will be able to move forward easily and effortlessly.
Okay, so
the whole spine is telling you that.
Correct. So if you have to give me one statement, if you feel taking the whole thing into consideration.
I move forward.
I move forward.
Aligning with soul's love, I move forward, aligning to my life plan.
Okay.
With soul's love, I easily and effortlessly move forward by aligning to my life plan.
Okay, ma'am. Thank you so much.
I hope that works. Thank you.
Yes, thank you so much. Thank you.
Wonderful. Thank you so much, Varsha. Yes, Neeta. You'll have to switch on your camera, Neeta.
Yeah, thank you. Hello.
Hi.
Hi, hi. I'm
Where
actually
is
new
Nita?
to, I'm new to
Nita,
Redikall.
Nita, I'm not able to see you.
Oh, I'm here.
Yeah,
You can see me?
yeah.
Yeah,
Yeah, I can see.
yeah,
Yeah.
yeah. So I have this problem where just at the crown, I have hair which gets tangled. There's a particular area where it gets tangled. So suppose I have brushed my hair today and I untangle it. Again, tomorrow there is a tangle over there. So I don't know how to find out what this is because each
Okay, so
time
can you show me the exact area?
I'm actually wearing on a turban being a Sardani, so
Yeah,
it's at
no
the
problem.
crown. It's at the crown,
Okay,
crown sort of thing. Yeah.
okay.
So I have got long hair and I do brush it every time, every day, in fact. But like just now, I untangled it, and again after a day or two, again there is a tangle, and it's in that same strand of hair that I have.
Okay. So the what comes to my mind is any like faith issue. Like, have you changed any faith, like from one master to another master, and you feel that you are getting entangled to things?
No, mine is a love marriage. So from
No, no,
Jain,
no, no,
yeah,
no, no, no. Yeah. Okay. Tell
yeah,
me.
married to a Sardar, but this is just from a year's span or something like that, year, one and a
Okay.
half year.
Any
Yeah.
have you changed like what you were used to believe and now what you are doing? Any change in that? Because the particular area what you are showing is related to either crown chakra or related to the consciousness chakra, you know, or the divinity chakra.
Not that I've changed faith, but just I'm becoming more open to different, like how radical is something that I've not heard of. So I'm
Yeah.
just becoming
So
open to new modalities and new things. But the faith is, of
okay.
course, to the one divine one. Yeah.
But any guilt of opening up to anything and leaving something behind?
No, no
Nothing.
guilt.
Okay.
No.
Okay.
Yeah.
So you can just affirm that divine in me helps me to detangle, remain
Okay.
detangled.
Okay.
Yeah, or you
Thank you.
can say my higher consciousness guides me to detangle.
Okay. That sounds wonderful. Yeah, that sounds
Yeah.
wonderful. Thank you. Thank you.
You're welcome, Neeta. Thank you so much. So I had said after Neeta, I'll take Rina. Rina, can you switch on your camera, please?
My camera is on.
Yeah,
Can you hear?
Yeah, we can.
Yeah. I basically wanted to ask, like, I have severe calf pain. It's been there for many years, and I've been doing like a lot of exercise so that it releases it. But especially at night, when I lie down, there's a lot of calf pain, and I'm not being able to really solve this. Somebody said it was related to the stomach. Somebody, so I've been trying different ways of dealing with it. And I think
Okay.
because of that, then I'm exhausted in the mornings.
So Rina, basically you have to find out calf muscle pain is if you have an underlying diabetes, underlying deficiency of B12, and calf muscles are the another heart. It is considered as a second heart. Rina, where are you? I'm not able to see you.
I'm
I can see you. Yeah. So calf muscles are considered as a second heart of our body. Okay. So any emotions which are trapped and which have not been recognized and resolved, they
okay.
get over there they get stored. So you need to find out that what are the emotions which are getting stored, and you need to release it. You have to recognize it, you have to acknowledge it, and you have to release it.
What would be the statement for me then?
Yeah. So with soul's love, I recognize and resolve all the stored emotions.
Grief and emotions.
Okay.
I recognize and
Really
Resolve.
resolve.
Yeah.
Release.
I release.
With soul's love, I recognize and release
Yes.
all the stored grief and emotions.
Okay.
And try and find out about your sugar level and as well as your B12.
So far, I did the test a year ago. Both
It's
were okay.
okay.
Both
No
were
problem.
fine.
No problem.
Okay.
Okay.
And I have one more question. My mother, she's 92 and she's had a cough we have tried every kind of treatment, every kind of thing the last 40 years. She's just had we don't know. First they said something to do with the stomach, something to do with this, with that. I mean, we've now given up and we are not, she as the constant, she gets into a coughing fit very, very often, very, very often, like at least 4-5 times a day. So
Okay. Just check for acidity level. If she has acid in the body which comes up, and because of that, the soft area of throat gets irritated and there is a coughing. But otherwise, it can be due to she is unable to express or unable to cough out whatever she wants to talk.
I think that would be it. Yes, that would be it. What would be the statement for her?
So for her, I think you can just admit it. I admit her continuous dry coughing under the loving care of Redikall consciousness. You can do it for her since she is 92-year-old.
No, she is very good with all this. She does.
You can give her this, no problem. You can give.
So it would be?
I admit my need to express. If she is doing, then I admit my need to cough out or express myself under the loving care of Redikall consciousness. Because it's been since so long. That's why I'm giving you this.
Okay. Cough out and express myself.
Under the loving care of Redikall consciousness.
Okay. Thank you so much.
You're welcome.
Thank you.
Okay, we just have 10. Actually, we've exceeded our time. It's only till 11. So we have 8 minutes more. Please make your questions short. And we will have Rina back maybe next Friday if she has the time, because I know a lot of you want to talk to her. So if it doesn't happen today, don't feel bad. We will have her back again. Okay. So yeah, Suman.
Yes. Rina ji, I have this issue of holding the urine or urine leakage. बहुत मुश्किल हो जाता है. Sometimes it's really difficult for me.
Okay. First, though, you have to work on uterine muscles, wall of the uterine muscles. You can do pranayam because, it's a mechanical problem. So, like any amount of medication is not going to help in this.
Yeah.
So, basically,
I'm very regular with yoga. We are doing it from the last 5, 6 or more than 10 years. We are very regular with yoga also. 1 hour yoga, good exercise. But then this issue is there. It is still there.
So you have to work on your emotion of lack of control over things.
Okay.
I think you got it.
Okay.
Awesome.
Thank you.
Thank you. Thank you.
Yeah, thank you, Suman. Yes, Shubhangi.
Hi, good morning, Aarti,
Good morning.
Rina.
Hi.
What a wonderful session and so lovely to see you, Rina.
Same
Amazing
here.
answers, beautiful answers. Just one quick question. What is the cause for raised levels of uric acid over a very long period of time, which results in frequent bouts of gout?
It's basically gout is about the issue with the authority. It can be the authority figure in your life, like a father figure or a husband, or even the authority figure like your masters or a god. You have to work on that.
Any
It's
statement?
a passive-aggressive behavior. Statement? Okay.
That is the story of my life. PAB.
Yeah. Okay. So I constructively comply with all the authority figure in my life and opt for a win-win situation.
Done, Shubhangi?
Thank you. Thank you so much. Thanks a lot.
Thank you.
Thank you. Before we have the other people come on, quick request from all of you. We need your feedback today, definitely a strong feedback, okay? Because if you want more such programs and if you want Rina to be back on this platform, we need wonderful feedbacks and even critical ones if you want to do that. So don't deny.
Yes, I'm open to it. I'm open to it.
We are open to everything.
Both.
Yes. So, but we do need it. Please don't just say it was very nice session and all. Give your feedback, okay? So that we can have more such sessions on other topics also. But Rina is coming back. That is clear. That we know. Okay. So next person, Paramita. Yes, Paramita. Paramita. Yeah.
Yes, madam.
Yeah.
Very often, my end of the lower portion of the spine and both side of the lower back have the pain, and it's continue to both hip joint and both thigh muscles also.
Okay.
Waist, hip joint, and thigh muscles.
So basically, I think some attachment which is not allowing you to move forward in your life.
Is like I have family, maybe have to listen the family's words. Maybe I want to something else. Maybe progress in the career. I don't know. This is related to it or else.
So what exactly you are showing the places, it tells us that you get to, I mean, you need to remain detached to all the environment as well as family issues, and you have to move forward positively, which you are holding back. And that is why your body is telling you. See, our body always whispers, and when we don't listen to the body whispers, it makes it loud. So I mean, I would tell everyone, pardon?
With soul's love, I detach my all family issues and other things.
No, wait, I'll tell you. With soul's love, I move forward with detachment.
Yeah.
With soul's love, I move forward with detachment.
Detachment, yes.
Thank you, madam.
Thank you. Thank you, Paramita.
Thank you,
so much.
Paramita. Thank you. Yes, Parmeet.
Hello, Dee.
Hello.
Hi, ma'am. Actually, my son is having epilepsy, and he had left side hemiparalysis, ma'am, when he was born. Actually, yesterday only, Uma ma'am has done surrogate healing, and really it was, I mean, it was a shock moment for me because the things which has come and they are amazing. मतलब radical is too, मतलब इतना deep है उसके अंदर और कुछ समझना मतलब बहुत ज्यादा deep है radical. हर एक चीज उन्होंने मतलब खोद के निकाली है जो सच में एक्चुअल में हुआ था, जो भी हुआ था उन्होंने सब बताया, उन्होंने स्टेटमेंट्स दिए. आई एम डूइंग इट. जस्ट आई वांट टू नो कि उसको होम्योपैथी देंगे तो कितना फर्क पड़ेगा, क्योंकि उसको एपिलेप्सी 12 जब वो 12 इयर्स का था तभी से है, एंड नाउ ही इज 23 इयर्स ओल्ड. बीच में वो ठीक हो गया था काफी, बट उसके साथ ऐसे होता है ना मैम कि थोड़े दिन वो ठीक, हर एक मतलब मेडिसिन के साथ उसके साथ ऐसे ही होता है, मतलब कुछ भी हील होता है थोड़े दिन के लिए वो इफेक्ट रहता है, फिर अगेन ही कम्स बैक टू जीरो इन द सेम कंडीशन एज ही वाज. और ये बहुत सालों से ऐसे ही चल रहा है उसके साथ. और ये पैटर्न मुझे समझाया उमा मैम ने, वो उसके स्टेटमेंट्स उन्होंने दिए एंड दे आर वेरी रियली अमेजिंग. जस्ट आई वांट टू नो कि उसकी मेडिसिन्स भी कुछ इफेक्ट होगी उसको.
We can try the medicine, but we cannot stop the allopathic medicine.
Yeah,
slowly
allopathy,
after few months we can taper it down, but that is also very difficult because unnecessary we don't want to play with the life of the child.
I have done that. मैंने किया था कुछ साल पहले, होम्योपैथी चालू की थी, उससे डॉक्टर्स ने मुझे कम करने बोला दवाई, एंड मैंने थोड़ा थोड़ा कम करती गई, बट इट अफेक्टेड सो बैडली कि
That's
थोड़ा
what.
टाइम बाद ना इतना शूट अप हुआ उसको एपिलेप्सी कि वो अनकंट्रोलेबल था मेरे लिए.
That's what I'm telling you, that taper करना भी शायद मुश्किल हो जाएगा. But what Uma ma'am has given you, continue with those statements. At least do it for 21 days and you can
Yeah,
come back to her.
And
Okay.
Parneet, if you want to get in touch with Rina, she's in Bombay only, so you have no problem. You can meet
ओके
up
ओके.
with her, you can go.
एंड एक और सिंपल सा एक क्वेश्चन है मेरे लिए है. वो एक मुझे ना हर समर में ना एक प्रॉब्लम होती है इचिंग की. आई जस्ट वांट टू शो इफ यू आर कंफर्टेबल मैम.
Yeah, sure.
ये ऐसे हो जाता है रेडिश में.
Which is the part?
इट इज ऑन माय बिलो नी.
Below knee. Okay.
इधर पसीना बहुत आता है. बैक में भी है. पूरा बैक पीछे पूरा नीचे तक हिप एरिया तक है. एंड जिधर ज्यादा मुझे पसीना आता है ना वही होता है मोस्टली. कभी कभी मुझे ब्रेस्ट के नीचे भी होता था, बट इस बार उधर नहीं हुआ है. बट एवरी ईयर आई हैव दिस प्रॉब्लम.
I think you need to work with your belief system. And this particular, what you are showing the places, what comes to my mind right now is need to surrender.
बहुत इचिंग होती है मैम उधर.
हाँ, so belief system related to surrender.
Okay, please give me the statement.
पहले तो only do it with the belief system. I artify all my belief system related to surrendering to the divine.
I artify all my belief system
related to surrendering.
Related to surrendering. I artify all my belief system related to surrendering. Artify all my belief system related to surrendering. Okay.
To the divine, to the master, whatever you feel right. To my higher consciousness, whatever. And forgive yourself for all the things, whatever is happening in your space. You have to forgive yourself as well as forgive everyone.
Forgive myself and forgive everyone.
Yeah. It is safe to forgive myself and all. With soul's
Sorry?
love, I forgive with soul's love.
Yeah.
I forgive myself and I forgive all.
Okay. Okay, thank you. With soul's love, I forgive myself and I forgive all. This statement जो पहले वाला बोला था, I am not able to repeat it clearly. I artify all my belief system related to surrendering to the divine. That's it?
Yes, yes.
Okay. Thank you
all
so
my
much.
adverse belief, write it, make
All
it
my
adverse belief.
adverse beliefs. Okay.
Thank you.
Thank you very much. Thank you so much.
Thank you so much.
Thank you, Kripa. Thank you, Parmeet, for participating also. And now we've come to an end to our session today. And for this, I have to be very, very grateful, Rina. Thank you so much for taking out that time to be with us, spend this lovely time with us, all of us. And I think they all needed it. They all needed to see and hear you and understand how beautifully you love everything and love everybody with what you do, right? So, yes.
Thank you, Aarti, and thank you everyone for your presence and holding the space. Thank you so much. Thank
you, Rina ji.
Masters. Thank you so much.
Thank you, Rina ji. Thank you so much.
Love
Thank you, Aarti.
you.
Thank you, everyone. Thank you.
And
Lots of
again,
love to everyone. And Aarti, lots of love and hugs to you.
Thank you so much, Rina. And you know it, you are going to be on this platform again because I know I'm going to get a lot of requests from people to have you back. I hope you'll be able to take out time again someday.
I'll try my level best.
I know. That's very great. Very, very graceful of you. Thank you so much. And everyone, please do give your feedback today because that will motivate me, Rina, too, to want to come back.
Genuine feedback.
Yeah,
you.
genuine.
Thank you.
You are great.
Yes, Rina, really, really grateful to you. And thank you, Aarti, for bringing her. It was a beautiful thought, and yes, really appreciate. And thank you for all your generosity, Rina, for always sharing, always.
Thank you. Thank
Please
you.
write
Thank you
all
so much,
write,
everyone.
Yeah,
write
you are
all this
really
down.
lovely. Thanks a lot. It was quite informative session.
Yeah.
Thank you,
And
Ami. Thank you.
please write your feedbacks in the Seekers group, all of you. Okay?
Yes.
Thank
Yes.
you so much. All the best.
Thank you.
Bye.
Thank you. Bye-bye.
Bye.
Bye-bye. Bye.
Aarti ma'am.